So, Victor Montori, we've just wrapped up a terrific hour on WIHI discussing minimally disruptive medicine as a really potent provocation and guide for shared decision-making. This was partly discussed during the hour, but I want to come back to it. What has been the uptake with this, and what do you think are some of the challenges right now?
I think that the notion of minimally disruptive medicine, and that is a medicine that pursues patient goals while minimizing the healthcare footprint on people's lives, is very attractive. And it's been very attractive internationally, frankly. The citations, the mentions in blogs, particularly exciting for me, the mentions by patients in patient blogs, has really exploded since we came up with the concept in 2009 with my colleagues Carol May and Francis Mayer from the UK. And we have been working now for the last 5-6 years in taking the concept, the idea, and operationalizing it. What would it take for medicine, for healthcare, to be minimally disruptive, maximally supportive, Goldilocks, attentive to patient goals without overwhelming them or their families? That is, I think, a long journey that will transform medicine. In that early stage of that journey, we've identified several things and they have been slowly being brought up. But many of them are things we're already doing, but we need to bring them within this realm. For instance, shared decision-making has been used to represent conversations that patients and clinicians have about what is best for them in terms of their values and preferences. But we've added another component to that idea, which is not only what is best for patients in terms of their values and preferences, but in terms of their context and their ability to implement what is feasible in their context to do to address their healthcare situation. Medication therapy management is something that pharmacists do to try to reduce the potential toxicity and harm in patients that take multiple medicines. But they can also use those visits with patients to look at the list and ask the question, even within the things that are correctly prescribed and indicated by evidence-based medicine, are all of them of help to this patient and justified by the burden they impose on the patients. Coaching that is being used, self-management support that is being used in patients with chronic conditions. Aligning that work not only with the ability to self-manage, to be able to implement the care as designed by the doctor, but also self-manage so that the care can begin to be feasible in a life that is always interrupted by something that's more urgent and also more meaningful, which is life. The issue of occupational and physical therapy, sometimes an afterthought for many clinicians. But if you have a bad knee, a cane can make you go further and faster, or a wheelchair, or a walker, or an elevator in your house. Occupational therapy that lets you get more skill out of perhaps the one arm that works very well for you. Things like that will increase the capacity of patients are already in the healthcare system, but they're not aligned in a particular way with a particular goal. They're brought up almost by inspiration rather than by system. So minimally disruptive medicine brings all these resources under one umbrella, the umbrella of advancing patient goals while minimizing the healthcare footprint on people's lives.